systems ultimately convey their impulses to the sensory cortex. The sensory cortex is a primary sensory area that is also called as S1 or first somatic sensory area, which is located in the postcentral gyrus containing the Brodmann areas 3, 1, 2. The area 3 responds to light touch. The area 1 and 2 they respond to deep stimuli such as pressure and joint movement, and it is supplied by afferents from both the sides of face and opposite side of the body. If you see in the spinal cord, the ascending tracts, they are mainly the dorsal column, the lateral column. The dorsal column, they mainly run in the posterior aspect of the spinal cord, whereas lateral columns like lateral spinothalamic tract, ventral spinocerebellar, lateral spinocerebellar, they are going to run in the lateral aspect of the spinal cord, whereas anterior spinothalamic tract, they run in the anterior aspect of the anterior part of the spinal cord. Sensory homunculus. The different areas of body have a topographical representation in the postcentral gyrus. The representation is such that the body appears upside down. Thus, foot area occupies the most medial part of the gyrus, which is on the medial side of the cerebral hemisphere, and the face area situated in the lateral part of the gyrus. The tongue occupies in the position further down than that of the face. However, the parts of the face are not represented in an inverted manner. So here you can see the cerebral hemisphere, and you can see the area of representation in the lateral cortex. If you see carefully, the representation is upside down, whereas the face is in the lower part and the legs are in the medial part. And the area of representation, it mainly depends on the number of the receptors they have in that particular area. This is the area for the leg, foot, trunk. This is for area of hand. This is for the face, where the face is actually it is not inverted. Areas of the body which they are sensitive, that is where the population of receptors are very high, occupy bigger space irrespective of actual size of the organ. The sensory homunculus represents opposite half the body, as both lemniscal and anterolateral system have crossed the midline to end on the opposite half the cortex. Functions of S1, that is parietal cortex. Widespread bilateral excision of somatosensory area 1 causes loss of the following types of sensory judgment. The person is unable to localize discretely the different sensation in the body parts. Then, however, he or she can localize these sensations crudely, such as to a particular hand, to a major level of the body trunk, or to one of the legs. Thus, it is clear that the brainstem, thalamus, or parts of the cerebral cortex are not normally considered to be concerned with somatic sensation, can perform some degree of localization. Second, the person is unable to judge the critical degrees of pressure against the body. Then person is unable to judge the weights of the objects. Then the person is unable to judge shapes or forms of object, and this is called as astereognosis. The person is unable to judge the texture of materials because of this type of judgment depends on highly critical sensation caused by movement of the fingers over the surface to be judged. Note that in specific absence of only somatosensory area 1, appreciation of pain temperature sense is preserved both in quality and intensity. But the sensations are poorly localized, indicating that pain and temperature localization depends greatly on the topographical map of the body in somatosensory area 1 to localize the source. Secondary sensory area is located on the parietal cortex in the lateral cerebral sulcus. Removal of it produces deficits in discrimination power.